So you're getting liposuction. Should the doctor close the incisions or not close the incisions? I'm David Rapaport. I'm a board-certified plastic surgeon here in New York and founder medical director of Aethos, here to answer some of your questions. So it's really pretty simple. Two principles here. When you do lipo, stuff's being injected in, then fat sucked out, and we do want fluid to drain out of you, okay? So we don't want to close anything hermetically. We don't want to trap all the leftover fluid and fat in there, especially the fluid, because then you'd be at more risk of getting a seroma, which is a buildup of fluid. So you don't want that. But on the other hand, if you just make an incision in most places in the body, a little incision, we're talking 4 millimeters, right? Like half of a USB-C. But still, when you make that little cut, the skin opens, right? And if you just leave it without closing it, it's going to heal just like a chickenpox scar. It's going to heal like a round little dent. That's not beautiful. Whereas if you put one little stitch in the middle, and I prefer nylon, meaning a material that you must remove in a week, okay? I'll explain in a second. Then you've got a fine line instead of a chickenpox hole. And if that's well placed, well hidden, it's hopefully going to be invisible in a few weeks. So that's the summary of to stitch or not to stitch. Now inside the belly button, where I use very often because I have the experience and confidence to go through there for abdominal lipo, that skin collapses immediately. There's no need to throw a stitch in there, so I don't stitch there. But anywhere where there's a gap, we put a stitch in. It still allows fluid to drain, but it stops you from getting a dent, a hole, something that looks like chickenpox. Hope that makes sense, okay? Now, next question people ask is, what about a permanent stitch versus a non-permanent stitch? Usually they don't ask, but you might want to ask. Now, a non-permanent stitch, meaning a dissolvable stitch for closure of anything, has the advantage that you never have to come back to the doctor because it's going to dissolve. But now, from a cosmetic point of view, there's a disadvantage. And the disadvantage, if you think about it, is that a stitch has to last as long as you need it before it starts dissolving, right? Because if it's dissolving while you still need it, well, then your wound might open up. So let's say you need it for 5 days. With my nylon stitch, I take it out in 5 days. Everything's perfect. With your dissolvable stitch, it has to last that long, and now it's starting to dissolve. That means that it's acting as an irritant for extra days, and it's a foreign body within your body. And especially if you're darker, you may react with something called post-inflammatory hyperpigmentation, which is darkness there that can last a couple of years. So the answer is, with someone white that doesn't really want to come back, yeah, we can put a dissolvable stitch, but really, the best thing is a stitch that you take out in about 5 to 7 days. Hope that answers the question.